We're here at JFK with Dr. Grace Malantic, who in fact is a radiologist at JFK. Good to see you, doctor.
Oh, hello. Hi, welcome to JFK.
Everyone talks to me about the whole continuum of care in terms of breast health. What does it really mean from a practical point of view at JFK?
Yes, so JFK puts a really big importance on the continuum of care because actually we offer all the breast imaging services here, especially in this building. We do a lot of the breast core biopsies, fine needle aspiration biopsies, ultrasound guided biopsies, stereotactic core biopsies, and MRI guided biopsies. So a lot of imaging centers don't offer all of those features, and then if they have, for instance, if a patient goes outside of the area and they go to an imaging center that doesn't offer these features, then they have to come to like a center like this where we offer all the different modalities, mammography, ultrasound, breast MR, a whole range of types of studies that patients are available to get here. So, for instance, we get a lot of the outside imaging from other places, and we actually do their breast biopsies here. So,
well, hold on, back up. So you get someone gets referred, a patient gets referred because they can't do it in the other place?
The biopsies, generally. Some places, especially some imaging centers, they only offer mammography and breast ultrasound, and they don't offer the breast biopsies. So a lot of them come over here to our center, and they get their breast biopsy done here at the center. So once they have their breast biopsy here, at least this continuum of care, we offer all the other services, like you have the breast surgeons, a whole range of breast surgeons to choose from to have their breast surgery. For instance, if they have a positive diagnosis from their breast biopsy and they need the breast surgery, we offer a whole range of oncologists. So it's kind of like a one-stop shopping in one center where you can kind of get that stuff, where if you go to a different facility that doesn't offer all those things, then you have to kind of go to a center such as here that offers that full continuum of care. So
let me ask you this. Mammography's changing dramatically, breast health changing dramatically. Doctor, what do you see the future holding?
Well, I think there's a lot of new imaging features, especially for breast imaging. For instance, now at JFK, we have 3 new digital hologic machines, which I think is important. So the advantage of digital imaging are several. For instance, the DMIS, the DMIS trial, which was it came out in 2005. That was about 49,000 women that were in that study, with over 33 centers from the U.S. and Canada, and pretty much what the end of the trial showed was that people with digital mammography, for instance, women who are perimenopausal or premenopausal, also women under 50 years old, and also what was the last group of women? A woman with dense breasts. They have probably more advantageous having the digital mammography than non-digital.
So this technology is extremely important for the health of women here.
Yes, correct. Yeah, and it's also probably less radiation for the patient because you tend to take less pictures with digital mammography, and also the throughput of images and the efficiency is much more better than routine screen film imaging, which is the old technology. Let
me ask you before I let you go, Doctor, the most exciting thing about your work here at JFK is what?
I think doing the breast biopsies, since we do a lot of the breast biopsies for this whole area, I think just providing that patient care and getting that close relationship with the patients. They actually have a strong connection here, especially with JFK, and we also have a breast center nurse navigator who follows these patients really closely. So
helps them get through the process.
Correct. Yes. So, for instance, even if they don't have a positive diagnosis, we have a breast center nurse navigator who follows them from the original time of the biopsy request all the way down to after the diagnosis, and also after the post-treatment, after chemotherapy and radiation therapy, just to make sure that there's someone with them, along and helping them and giving them support.
You love what you do.
Yeah, I do. Actually, I do, yes.